ICU beds few and far between in the state. Even with the addition of 18 beds from Baptist Health, those we spoke with at Comm say they're still having problems finding beds to put COVID patients into.
Jessica Rank joining us now live at MEMS where Comm is located. Jessica, what's the situation like over there?
Yeah, Bob and Laura, well, Comm employees essentially work behind the scenes when a hospital doesn't have enough space for a COVID-19 patient. It's their job to call around to other area hospitals to see if they can try and find a bed for that patient. Now, that process usually takes just a few minutes, but right now it's taking up to hours and even days at sometimes. Like a well-oiled machine.
Arkansas Trauma Comm, this is Eddie.
These callers move patients from one hospital to the next.
It's red light, green light. You have availability or you don't.
Now bolts are rusting and the machine that once was is running at less than full speed.
This surge is much more difficult than the winter surge.
Comm isn't getting more calls than it was in December, but with fewer ICU beds available, the problem now is finding openings, even for just one patient.
COVID ICU admissions are higher, and those patients stay in the ICU much longer than a non-COVID patient. Staffing levels are down, so it's the perfect recipe for the perfect storm.
Pre-COVID, the center assisted trauma patients. The wait time from the ER to a bed was about 7 minutes. Tabor says now COVID patients are waiting hours, sometimes days.
It's just do what you can do with now.
And when they can find a bed, it can take up to 11 hours to get there.
We've coordinated cases from Bella Vista to El Dorado, from West Memphis to Fayetteville, and then all in between.
Tabor says extra beds will help turn these red lights green. But in order to get the machine back to full speed, he says it's up to the public to step up and roll up. And people over here at Comm says right now the lack of ICU beds aren't really affecting trauma patients, but they are expecting it to happen in the near future because if you think about all the staffing shortages that we're also having with the pandemic, then that could be effective on beds and getting people into the hospital who are having heart attacks or even strokes. Live outside of MEMS, I'm Jessica Rank for KARK 4 News.